I think one of the biggest changes from the treatments that we have been traditionally using until now is previously we have been using standard chemotherapies with the idea that we're trying to kill as many bad cells and cancer cells and hopefully not as many good cells in our bodies. What we're realizing more and more is that brain tumors, one of the biggest challenges of treating this particular brain tumor, glioblastoma, is that they are so different on a molecular level from each individual patient. So you can give 100 patients with the same brain tumor, the same treatment, and their tumors will respond very differently. And the basis of that is that they're on a molecular level, they're all very different. So now we're moving toward a more targeted approach and a more individualized approach. And I think that the likelihood of finding a particular treatment that will be universally effective in all these brain tumor patients is not impossible, but low. I think that the most likely thing that we're going to find effective is that it's going to be personalized to each person's tumor and their molecular type, and the treatments will vary from patient to patient. There's certainly a recognition that individualized treatment is important. Currently, the targeted agents that have been FDA approved have not been shown to be effective in brain tumors as of yet. There are a number of reasons for that, and certainly one of the reasons is the blood-brain barrier that keeps out many potential effective drugs. So overcoming that challenge is very important, and I think that any effective targeted therapies will have to overcome that. Currently, the targeted therapies that have been developed are really meant for systemic cancers rather than brain cancers. And I think that once we have a better idea of what are the key molecular targets that we need to attack this tumor, then trying to develop things that will overcome the blood-brain barrier and other factors will follow. One of the types of treatments that we're developing that have a potential are personalized vaccines. And that is something that many people, patients and doctors alike, are following with great interest. The idea of being able to take a patient's individual tumor and having the patient's own immune system attack the tumor. And I think that may not necessarily be effective in every brain tumor patient, but what we're trying to do is find treatments that might work for a specific subtype of tumor and go from there. But I think that the concept of personalizing an immunotherapy is quite interesting.